Hi and welcome back to another video of Medic Notes. This video is on raised intracranial pressure. For introduction, the skull contains brain, cerebrospinal fluid, and blood. At normal intracranial pressures, these three components are in volumetric equilibrium. If one component is elevated, intracranial pressure will increase, unless the volume of the other two components decreases proportionately, according to the Monro-Kelly doctrine. Compensatory properties among the intracranial contents follow a pressure-volume exponential curve. Increased volume of any of three components can be balanced up to a certain level without any increase in intracranial pressure. Eventually a critical volume is reached where any further volume increase results in raised intracranial pressure. The effects of raised intracranial pressure include hydrocephalus, cerebral ischemia, brain shift and herniation, and systemic effects. First, hydrocephalus is a common complication of space-occupying lesions of posterior cranial fossa, which compress cerebral aqueduct and fourth ventricle. Next, cerebral ischemia. Effects of raised intracranial pressure are exerted on vascular component, and result in progressive reduction in cerebral perfusion pressure. Cerebral perfusion pressure equals to blood pressure minus intracranial pressure. Third complication is brain shift and herniation. This occurs following a critical increase in intracranial pressure. Lumbar puncture contraindicated as there is a risk of precipitating a potentially fatal brainstem herniation. Herniation may occur at the following sites: transtentorial herniation, tonsillar herniation, herniation of cerebellar tonsils into foramen magnum, causing compression of medulla. Medullary compression results in decerebrate posture, respiratory failure, and death. This is a table showing the affected or compressed structure in the brain, and its respective clinical manifestation. When oculomotor nerve is compressed, there is ipsilateral pupillary dilatation. When ipsilateral cerebral peduncle compressed, there is contralateral hemiparesis. If posterior cerebral artery compressed, there is cortical blindness. A compressed cerebral aqueduct will cause headache and vomiting from hydrocephalus. Compressed reticular formation will cause coma. Compressed midbrain will cause decerebrate rigidity and even death. Systemic effects of raised intracranial pressure include hypertension, bradycardia, slowing of respiration, pulmonary edema, and Cushing's ulcer in the gastrointestinal tract. The clinical manifestations of raised intracranial pressure are headache, due to distortion and compression of pain receptors within the dura mater and around the cerebral vessels. Nausea and vomiting, due to pressure on the vomiting center in the pons and medulla. Papilledema, due to venous obstruction. And decrease in level of consciousness ranging from drowsiness to coma, depending upon the level of the intracranial pressure. That's all for this video. Thank you.